Okay, class. This is the lecture on caring for the patients receiving anesthesia, pre-op, intra-op, and post-op. So this first slides talk about the pre-op phase, patient identification, making sure that your patient safety is followed. You, as the nurse in the pre-op area, is required to verify that consent was obtained, review the health history, obtain vital signs, go over diagnostic tests that were done, find out allergy information, making sure there's safety in the pre-op area, the OR, etc. Verification for all of the blood that the patient will also need to be followed. Once the patient is out of the PACU, you will take care of this patient until they recover from anesthesia. If the patient is received general anesthesia, you will make sure that the patient has a gag reflex before feeding this patient, have a right to go home, someone to pick up this patient. This patient cannot drive. You are to always stay with your patient for any kind of moderate sedation. You would never leave your patient alone. And you would continue to obtain vital signs and assess their motor and sensory function. You're never to discharge this patient from the PACU if they have received any kind of moderate sedation. As a PACU nurse, you will review information, conduct assessment, such as the airway, vital signs, cardiovascular function, surgical site, all IVs, tubes, and equipment. This is what you do as the PACU nurse, continually reassess your patient as they recover from general anesthesia. Keep in mind that patients who come to the PACU have received some sort of anesthesia and they're there to recover. When the patient has fully recovered, they may go home or they may be transferred to another unit. If they go home, again, making sure they have someone to accompany them home, make sure they understand their follow-up instructions, etc., and making sure if the patient will be admitted that you provide a shift report to the nurse and you tell the nurse what type of procedure the patient has, what their vital signs are, and if there was any complication, etc., during the procedure. Again, direct discharge, you would make sure that you provide written instructions for wound care, medications, follow-up, complications to return if they have a fever, etc. If they're having some kind of problem, with the drain, if there is one in, monitor themselves for fever, take their antibiotics, and so on. And this next slide pretty much summarize what I was saying about patients are not allowed to drive home.